My name is Robert Bona. I'm a hematologist in the section of hematology here in the Department of Medicine and at the Yale Cancer Center. I work primarily in the classical, also known as benign hematology program, and in the hemophilia treatment center. And I'm primarily involved in the care of patients who have blood disorders, namely those of excessive bleeding, excessive blood clotting, or those individuals who have abnormalities of some of the blood cells, such as anemia, low platelet counts, or individuals who have disorders of iron metabolism. I enjoyed caring for or being part of the care team for patients with blood disorders in medical school. I've always enjoyed looking at blood cells under the microscope and studying blood coagulation and blood clotting. Also, I went to medical school in Syracuse, New York, and at the time, the hematologists there were among the most renowned individuals in their fields in the world, really. So learning from them was truly inspiring. We care for patients, and often nurses are involved in the care, advanced practice providers, and certainly other physicians, including those in lab medicine and transfusion medicine, are important to the care of the patients I see, as well as related specialties in medicine, surgery, and radiology. So that team approach is very, very important for good care to our patients. I have always tried to be a compassionate physician. I recognize that it's so important to listen to individuals as they come into the office, and that skill of listening is something that is a lifelong skill, a skill that takes a life to learn, and I believe it's very, very important to develop that to a significant degree. When patients come for their visit, I think it's really important that they have a sense of what they'd like us to cover. So almost come with an agenda. And that might mean they want to discuss their diagnosis, or they'd like to discuss treatment for their disease, or perhaps they want to discuss diagnostic possibilities if a diagnosis has not yet been made. So I think primarily it's important that they come with a sense of what they would like us to cover during the visit. It's also important to have complete medical records. So that's easier nowadays with the electronic medical record. But on occasion, individuals will be referred to us from outside our system, and getting adequate and complete medical records is also quite important to us. I think bringing a friend, a family member, a significant other is always a good thing to do. We often talk about significant health care issues. Sometimes the issues are complex, and having another set of ears to offer a different perspective, perhaps, I think can be quite important. The research areas that I'm most interested in currently involve helping to evaluate new treatments for individuals with bleeding disorders or individuals with clotting disorders. I also hope in the future to make connections with some of the basic and physician scientists here at Yale to understand better some of the pathophysiology of the more complex diseases that we help take care of.